Sanitarium. Really pleasure, honor to work with you today.
Hello， Professor Anthony Teo， 我而家喺 CU 係Department of Surgery 係。
多謝你哋。
你好。
Right. Okay. It's exactly 5:30. Being good student, we are punctual in time.
punctual. Yes.
Okay. Thank you everyone for joining us. I hope this very quickly put together webinar is what you would like to hear from us, because we know a lot of parents have a lot of questions to want to ask and to learn from Professor Lau as well. Let me apologize if it doesn't run very smoothly. Please excuse us, because it's really put up together in 2 or 3 days with limited support. But I hope it'll be okay. So let me introduce our guest speaker, Professor Lau, to all of you. All of you have probably seen him before on the television for last year or so. He is the chair professor of University of Hong Kong, specialized in community child health. He is a member of the WHO Technical Advisory Group for Immunization and Vaccine Preventable Diseases. As you know, he is currently the members of the advisory panel on COVID-19 vaccine for Hong Kong HKSARG government. For your information, he was the chair of the scientific committee and has done so much work for the kids in Hong Kong on the vaccine prevention disease over the years, for many, many years, and pioneered many things. So a warm welcome. We're really grateful to Professor Lau to agree to speak to us today. Just very quickly, everyone knows that around the world, something is happening. I would call this a tsunami. If you look at this slide, isn't it? Over 358 million people, and suddenly, recently, there's a lot of cases. But I guess the good news is the number of deaths has not fallen up. So I think we might be in this comfort, slight comfort, so to speak, that this Omicron is not as fatal as before. But never mind, it's still a very serious illness. We should not downplay it. Just to let you know, around the world, as you see in US, the numbers have shot up. This is about close to 1 million cases a day. But luckily, the death rate has gone up a bit, but not all that much. UK may have seemed to turn the corner, the number of cases coming down, but so the death rate is not actually rising. But Hong Kong, we now see this the same way. We've been predicting that no one around the world can prevent it from happening. So this is a challenge we're faced with. What can we do about it? Now, we are most grateful to Professor Lau for sharing his understanding and his extensive experience in this matter and his views on this. But I think it's appropriate for me to say that, as you know, COVID is so different, and there are so many different views by different KOLs in Hong Kong and around the world. So I think the main point for us is to let you know more about what is going on with COVID, so that you can make an informed consent yourself. So that's the point. So without further ado, let me say to you that we'll Q&A at the end. So if you'd like to ask questions, please type in the chat box. We'll be looking at it and raise a question for you if you would like to. If you would like to ask the question yourself, please put your name at the end as well, because we'll call you up.
And also, I would like to welcome Ms. Lau. She's right here with us. So if any parents have questions for the school, I'm sure Ms. Lau will be very happy to answer them.
Okay, let me also
introduce. Yeah, I'll try my best.
Yeah, let me introduce our other co-host as well. Simon, say hello.
Yes, hi. This is Simon Tan, class of 92. Pleasure to be here.
Yes, I am also class of 92, Anthony Teo. So I think we've been working quite hard in the health medical chapter of DSOBA in previous webinars as well. So hopefully this webinar will be helpful to all the parents of DBS-PD.
So we'll welcome Professor Lau now. I have actually let you have the share screen, so maybe you can take over the screen.
Okay, thank you. So first of all, I'm most grateful to all of you giving me this opportunity to share some of my most recent views on COVID-19 vaccination in young children. And I'm most grateful to Ms. Lau, the head of this very wonderful, prestigious school, to brief the parents on this very critical issue now. Must be really in the front of the mind of most parents with young children. So in fact, I won't have too many slides. I will have 8 in total. Basically, what I wish to present will be what I've learned over the last 2 years, obviously from reading wonderful papers from colleagues all over the world, as well as some of the studies we've performed in Hong Kong. And of course, I focus on children. So this is the study we have started early last year, what we call COVAC, and now we extended to become COVAC. So that is COVID-19 vaccination in adolescents, because initially we focus on the secondary school population. So we are more or less finished that study in terms of those 2 1-month response. So we are just writing up. In fact, I was really going through all the tables and graphs. But obviously, I already mentioned the vaccination will gradually extend down the age to now to the primary school. So I have extended this study to primary school children sometime towards the end of last year. I think it's Q4. So I've been with many of my members, I've been vaccinating 3 to 11-year-old children, basically because at that time we think CoronaVac may be the choice for this group. So we have been experimenting with 2 ways of giving it either inside the skin, so what we call intradermal versus intramuscular. And the reason why we want to explore this route is from our secondary school study, we actually understand the antibody response after vaccination, comparing the BioNTech and the CoronaVac. There's no doubt BioNTech is superior in eliciting antibody response. Obviously, we have studied not only just the spike, which is the most frequently tested in private sector. We also went through the whole gamut of the various kind of measurements, including the plaque reduction. That is how it actually neutralized the real virus in the lab and so on. So besides the serological, that is the antibody response, we also look at the T cell response. So from our adolescent study, we are actually going through all the data point right now and found the T cell response to what we call the spike, which I think most of the parents might understand that is the protein outside the virus. And that is what the BioNTech, the mRNA vaccine, is really focusing on. While the inactivated form, that is the CoronaVac, actually contained the whole virus, but that's been inactivated. And therefore, because of the other components that is not present in the BioNTech, which is the other structural proteins, that means these are the proteins that make up the virus. Inside the virus, there's a protein called nucleocapsid. So you do not need to understand the name, but just saying it's like a television set. And obviously there are many components. So basically the CoronaVac is a whole TV thrown in. While the BioNTech is really peeling off the most important part that cover that television set. And therefore we found the CoronaVac, because of the other extra components, they actually able to induce T cells to some of this protein, that is the nucleocapsid. So that is the opening gamut. Now, obviously, we have recruited nearly I think it's close to 800 to 900 adolescents, children, and adults. So, basically, I've been with all these wonderful people for the last 10 months, going to the Offlabel CDC. And of course, that has been given back to the government, and we moved to Gleneagles Hospital and carrying on the good work. And the coming weekend, I'll still go there and finish off my recruitment of the primary school children I've just mentioned. But of course, I really need to thank someone that is our research nurse, the PhD MBBS student, there's a medical student who took years off to do research with me, and Jaime, and many other people. And of course, there's Dr. Tong and other people. Now, obviously, what's in your mind is whether I've got a young child, whether I should let him or her to get vaccinated or not. The really very clear message is yes, you should. in a way that because now with the Omicron, and this is the site where you could go into yourself, called I Will in Data. These are no secret. It's actually updated every day. The Johns Hopkins providing all the support, and you could actually go to various countries and look at their sort of current situation. And that is the current situation in Chile in January 2022. And you may not know 80% of the primary doses of COVID vaccine are CoronaVac, because Sinovac company has a very long cooperation with Chile, and therefore they have got access to the CoronaVac. So 80% of the first 2 doses in Chilean citizens actually got CoronaVac, and the 20% left would receive either AstraZeneca or the BioNTech that we are very familiar with in Hong Kong. All right. And then, of course, they went on to have the 3rd dose. And the 3rd dose, the Chilean government actually allowed them to make a free choice. So they could go for CoronaVac or BioNTech or AstraZeneca, which is of another platform. It is not an mRNA, it's not an inactivated, it's an adenoviral vector vaccine. All right. So what they have done is in the first week or so of January, because Omicron is also rising up in Chile. So, and I've particularly really just took out the 71 years old to 80 years old, all right? Because you, in this website, you could click all ages and then all different age group. And you could see for the old folks, not vaccinated or not fully vaccinated, that is only 1 dose. Out of 100,000 people, 21 died. If you have 2 doses, it dropped from 21 to 3.5. So that's a drop of over 1/8. If you had the 3rd dose, it go right down. So if you compare this with the 21.76, it's more than 20-fold reduction. So obviously in Hong Kong, if any of the parents sitting there listening to me, and you have your own parents or your parent-in-laws and not got vaccinated yet, so that is my first major message to you. Please see whether they should get vaccinated or not, because contraindication to vaccination with one or the other COVID vaccine in Hong Kong is far and few between. I reckon over 99% of our population have no contraindication to receive these 2 COVID vaccines. The doctors have been too cautious, and I have been too cautious, but that is rightly so at the beginning of the rollout of the vaccine. But now we have accumulated so much experience. In Hong Kong, we have given out over 10 million doses already. So any of the so-called allergic sort of contraindication is no longer there. And Americans are really revising their guideline, like allergy to food, to drug, and so on. They are not contraindications. Even if they've got allergic reaction to dose 1, it doesn't necessarily mean they cannot receive dose 2. So my first message is we have far, far too cautious, and therefore really fueling the vaccine hesitancy, especially in the elderly. Now, I put in all ages now, so it's to be fair, because children, when they get COVID, they're usually mild, but that doesn't mean they don't get sick, because a very tiny minority will get complication, like what we call MIS-C. That is an inflammatory condition. Of course, that is not as common as in the West for the East Asians, but it could occur. And of course, it's all number games. If you've got large enough of children got infected all at the same time, then there will be a few of them would get quite ill, got admitted to hospital, and some of them might even die. And that's what's actually happening in America, because their vaccination is very patchy, fairly good in sort of along the coastline and in northern states, but in the southern states, especially in the underprivileged, they are very poorly vaccinated. And a lot of children obviously has not got the vaccination yet. So of course, for all ages, then it's not as bad as the elderly, because the major risk factor for deaths, for fatality, for deaths after COVID is age. So every 5 years in advancing your age, your risk will go up. So obviously I belong to the high risk group myself, but of course not as high as those over 80 years of age. So of course, when you put everyone together, you dilute down from 21 to 3. But you could see it still work all the way down. That is nearly only 1/30 if you got the third dose. So the message too is that if anyone who has not got vaccinated, please, if you're eligible, go ahead and get your first and the second dose. If you're already eligible, your third dose, you go ahead and get your third dose. There's really no doubt in my mind. You should go for it. And therefore, you yourself will be protected from deaths and serious illnesses. And of course, some of you might have listened to my 香港家書. So in the Omicron age, whether you get 2 or 3 doses of either BioNTech or CoronaVac, you will get infected at the end of the day with Omicron because the neutralizing antibody elicited by the 2 vaccines, both of them more or less are useless after 2 doses. Even after the third dose of BioNTech, it will not last no more than a couple of months and then it disappears. Therefore, my third message is do not get frustrated or disappointed that you still got infected. So the whole point of getting vaccination is not to stop the infection with Omicron because it's not possible. It is to stop you when you get infected, you get serious illness, getting into the hospital. You need the oxygen. You need to go into what we call an intensive care unit and might even need to be put on a breathing machine, we call a ventilator, and you might even die. But having the 2 or 3 doses of either of the 2 vaccines will protect you very powerfully against severe disease, as shown by these 2 slides from Chile. All right, so that is for the CoronaVac as a primary 2 doses. But CoronaVac, in my mind, should have 3 doses to achieve the primary full vaccination versus 2 doses of BioNTech. Now, I will show you the real world data from America, but of course, in our world in data, I could not get more recent data than October. So that will not be Omicron era. It will be, I suppose, Delta era. So it's the same. This is for all age, right? So unvaccination, if you could remember the CoronaVac in Chile, the unvaccinated and partially is also about 3 per 100,000 people going vaccinated would die for that period of time, right? It is a rolling sort of data. And if you look at the Pfizer, 2 doses down to 0.48. Of course, it's not got a third dose, but third dose, I'm quite sure it will drop further down. So it's really good in preventing deaths. There's no doubt about it. So even if you got infected, it will prevent you from dying. Now, this is my second last slide because the choice sort of in front of the parents now listening to me will be whether you want to get vaccinated or not for your child. So my answer to is a resounding yes. You should opt for vaccination. All right. And of course, then the second question is whether you want your child to have CoronaVac or BioNTech. All right. And I listed on this table comparing the 2 because, as I've mentioned earlier on last year, my position is very clear. Having a choice is better than no choice. Second, we should be open, transparent, up-to-date, real-time information, and to educate our citizens in the clearest way we can so they can understand what are the pros and the cons in choosing the vaccines. Now, for BioNTech, maybe you have read from a newspaper, the formulation, what do you mean by formulation? That means that is the product that is manufactured by the company. Then in that bottle is called a formulation. And because in BioNTech, they have different formulation for the adults or young adolescents down to 12. And then for the 5 to 11, they have a specific, what we call a pediatric formulation. All right. So in Hong Kong, we have got no access to pediatric formulation. So in desperation, the government agreed to what we call an off-label use, using the adult formulation and taking out 1/3 of the dose. Because in America, the pediatric formulation is 1/3 of the adult dose, but they have a special bottle. They have different stabilizers for the pediatric use. So of course, the pediatric formulation is now used in USA because that's where it's made. And of course, Israel, because they have entered a very very early on, they have a contract with Pfizer to get everything first in the world, right? So that is what is the formulation. Regarding CoronaVac, the formulation is exactly the same as the adult for the 5 to 11-year-old. That means that there will be no special arrangement, and it will be much easier to get that dose for the child. All right. Both of them, at the moment, the government allowed 2 doses, not like those over 18. They need 3 doses. There are some reasons behind it, because children, they do not actually get as severe the disease as the elderly, as the adults. So perhaps the 2 doses may be enough as long as they do not have very severe pediatric illnesses like cancer, like sort of renal, that is kidney disease, that they need to be what we call dialysis or have a kidney transplant. Then they will need 3 doses, right? And then just to explain the time interval between the 2 doses for BioNTech, it's 3 months. That used to be 21 days. And some of you might remember in Hong Kong, sometime last year, when we started the 2 doses given to the young adolescents, 21 days apart, we found out they got what we call myocarditis very frequently, much more than what's reported in America. And it occurred in young males after 2nd dose. And the rate was as high as 1 in 2,800 doses, much higher than that reported in America by the authority in America. And we reckon in America, they have been underreporting. However, don't worry, all the cases actually recover from the myocarditis, but of course, they still need to be followed up. So no cases in Hong Kong actually have very sort of a prolonged serious illnesses. And up to date, there are over 100 cases of myocarditis after BioNTech, and about half of them are in the adolescents. And then about the other half is in the younger population, but not as old as 49. So the risk actually exists right through the age to about 39 or even 49, mostly males. All right, we don't understand why males or men are more affected. However, for CoronaVac, the way to give it is exactly the same as an adult, 2 doses, 28 days apart. All right, because of the very traditional platform. So in terms of what we call reaction after BioNTech and after CoronaVac, is very clear. BioNTech had more reactions in terms of fever, muscle pain, headache, need to take what we call Panadol or paracetamol, than those who took CoronaVac, because we've got data and the whole world's got sort of more or less the same data as well. So it's exactly the same as adult. Okay, so in Hong Kong, we use off-label use because we think there should be a choice for the parents. So the off-label use means we take a vial from the adult formulation. In the adult formulation, 1 vial, you could get 6 doses. But since for the pediatric use is 1/3, so theoretically, for 1 vial, you can get 18 doses. But of course, that is too dangerous because you can't puncture the cap of your vial 18 times and hoping the rubber could still stand. So now the government will need to have what we call a standard operating procedure for the pharmacists to be trained to get that 1/3 dose from the adult formulation very accurately. And that SOP has been circulated to us just this afternoon. All right. So that's why BioNTech cannot be given outside the 3 vaccination sites right now, because they need highly trained people. So make sure when you take out the 0.1 mil instead of the 0.3 mils for adult, could be taken out very accurately. All right. So make sure it's not getting more than 0.1 mil and not less than 0.1 mil, right? Versus CoronaVac, since it's really the same as the adult formulation, and we have already over millions and millions of doses given in Hong Kong already, so there's no special training, so it can be given in the ordinary CVC by private doctors in over 1,000 practices already joined it, I think. And of course, the government will be very confident to send out the school outreach team to give the CoronaVac, because CoronaVac need no storage in very cold environment, while BioNTech need to be stored in -70. And once it's taken out and then diluted and so on, it only keep at a room temperature a few hours, and you have to give it. So that is the kind of differences. Now, in terms of the safety, I already mentioned the myocarditis must be very high in your mind, because I think Dr. Guan and Patrick Yip and Ian from the Hong Kong U, as well as from PMH, already highlighted this myocarditis. So I just affirm, yes, BioNTech has been associated with myocarditis, especially in the young males, I've mentioned to you. But they all recover, all right? But of course, they need sort of long-term follow-up. While in CoronaVac, in terms of the number of doses given for 5 to 11 years old worldwide, mainly in mainland Chile and Indonesia, Turkey, and so on, the safety data did not show any myocarditis. And the same conclusion was made when Ian Wong and Mike Wan and Patrick Yip yesterday. I think I read from the newspapers. Again, there's no myocarditis associated with CoronaVac. So if you are mindful of safety, and that is the data for you. Now, every one of you heard so much about antibody, especially neutralizing antibody. And I've already told you, there's no doubt BioNTech elicited much higher neutralizing antibody than CoronaVac. So I've got data to show 3 doses of CoronaVac is just approaching the 2 doses, but still not as good as the BioNTech. So that may be of some advantage during the pre-Omicron era, because those vaccines are targeted not to Omicron, but to the ancestral ones. But Omicron has moved on to change the spike so much. So the neutralizing antibody elicited by the current BioNTech and CoronaVac cannot recognize the change, the spike that well, to the extent that they are either useless or even after the 3rd dose, they would kick up a bit, but they should, and I think would disappear very rapidly within a couple of months, because that's what antibody is. Antibodies is akin to your cash. You use a cash and it's gone, right? Now we move, but those are important immunity to stop the infection. But in fact, coronavirus cannot be stopped. And antibodies always wane with time, always decrease with time. Now, of course, you have heard, perhaps in Hong Kong must be one of the societies that heard about T cells much more than many other societies. And of course, now the community doing all the research would understand why, say, BioNTech, although the neutralizing titer has gone down so much, but they're still protecting them from severe disease. It's really because of the T cells. And the same for CoronaVac as well. So you remember, I've used a television set. So since BioNTech has only got the outer coat of the television set, that is the S, and then the BioNTech would only produce S-specific T cell. All right, CoronaVac, we have data to show the adolescent, not 5 to 11, but 11 to 17, they produce comparable S-specific T cells. But I've already told you another protein called nucleocapsid inside the television set that is present in CoronaVac, but not in BioNTech. Of course, logically, because it's not there, therefore, BioNTech recipients will not produce the N-specific T cell, while the CoronaVac recipients would produce the N sort of specific T cells. Not only N, we've got what we call the M, that is the membrane as well. So when you add up all the S, the M, and the N specific T cells, CoronaVac is better than the BioNTech. So 1 up, 1 down, 1 up, and 1 down. All right, so there's in the whole world, you cannot get everything good on one side. So there must be the 2 sides of the story. Now, I already told you whether you got 2 or 3 doses, you will get Omicron in time. All right. So after the third dose of BioNTech, your neutralizing antibody will be kicked up to a level that might sort of prevent infection in about no more than 70%. But in sort of 2 months' time, it dropped to really less than 20%. And the titer is very low. So that's why in the newspaper, you've read whether you get 2 or 3 doses of BioNTech, you still get Omicron, and the same for CoronaVac as well. So do not have the delusion that we can stop Omicron infection or transmission. We might be able to reduce it, but we cannot stop it. However, for both vaccines, they are very good in preventing, once infected, you get severe disease. So in my mind, choose one that fits your purpose, and then you get vaccinated. Now that is my last slide. So this is about, the adolescent attitude. This survey was done nearly a year ago now. At that time, the vaccine wasn't approved for the adolescents yet. And of course, the sample size is quite reasonable, over 3,000. And of course, at that time, only 30% are willing to get vaccination. But now you understand, with all the education, with all the risk-benefit assessment or the knowledge accrued by the parents and the secondary school students. I think yesterday we already got 83% of the secondary school age population already got a vaccination. All right. So I would expect the rest of the whatever 10, 20%, more or less all of them, of course not everyone, will get vaccinated as well. So at that time, only 30% want to get vaccinated, 70% did not want, and the major concern is the safety. And then the second is whether it's going to be of use or not. While for that 30% who want to get vaccinated, that is, I think it's April, I think, or May, they're worried to be infected, so they're quite rightly so. And then they want to protect their family. And of course, they want, just like all of us, want to return to normalcy. But of course, there will be a change. Well, there will be a new normalcy. It will not be the old normalcy. All right, I think I have finished. And I've been a bit long-winded. At first, I thought it's 15 minutes. My God, it's only already half an hour. Okay, 咁啊，交翻俾你啦。
Okay, thank you
啊
so much.
等人係。
You can release your screen share, then we can have everyone on the picture again.
好，我 stop share 㗎啦。
Wow, great. I now can see everyone. In fact, there's 233 of you on
Okay.
this webinar.
Yeah.
So I think
Yeah,
there's a lot
thank
of
you for your
interest.
attention. Thank you. I'm most
Yeah.
grateful.
So grateful of you, Professor Lau, for giving us to me is I always admire the pediatrician. You have a way to explain things that we elder doctors cannot do so.
我冇咁講，因為我哋要氹細路。
Yeah, a way to talk to people. But anyway, I think earlier I shared to you, I think there were 5 W and 1 H that everyone wants to know. Why do we need to do it? What this is all about? What a choice? When should we do it? Who should have got it? Is anyone should not have it? I think we will raise some questions. And where can we have it? And how do we have it? Before we open the Q&As and my co-host to share that, can we invite Ms. Low to maybe, since we got so many parents here, to share with us the situation as the school has been instructed by Education Bureau, or what is the plan? I know you have sent out a letter asking the parents to indicate their wish or indication. So we welcome Ms. Low to share with us how we're going to move forward.
First of all, thank you very much, Professor Lau, for sharing your insight, your understanding about the COVID vaccination for children. And then because we got 2 circulars or memorandum from the EDB last week, so it's our obligation or the responsibility to pass the information we got from the EDB to parents as soon as possible. So on Monday, we issued the circular. So it's actually a survey to find out how many parents you will indicate to give consent for your boy to get vaccinated. Now, so initially, we'll try to find out the number first, see if we will be able to provide some sort of school outreach vaccination service, so that parents will be maybe more willing to put your child in a safer, more familiar school environment for the vaccination. Or anyway, there will be another option for BioNTech. Definitely, you have to bring a child to those vaccination center to get the vaccination. And then, so that will be some arrangement that we are preparing. Now, so we got some guidelines from the EDB. Now, if we will be able to have like more than 150 participants for the vaccination service, so we'll contact EDB. And then we'll also be issuing another circular to those parents who indicate that you would like to have your child having the vaccination, most likely after the Chinese New Year holidays. Then initially we will have we've tentatively set the first dose, the date for the first dose in March, and then the second dose in May. That is after Easter holidays. So anyway, now we'll send the information step by step when we have more information from EDB and also getting the feedback from parents. We will be arranging the covered playground as the venue for the school outreach, so that it will be well ventilated. We'll provide a lot of staff members, and maybe we also recruit some parent volunteers who have medical background to back up, so that we'll try to arrange the site and then to provide a good environment, so that parents will be able to have a peace of mind while you accompany your boys to come to school to have the vaccination if you opt for that. I think it's initially the information that we can provide. I can guarantee every information we get from the EDB, I'll pass on to parents as soon as possible. Now, the Chinese New Year is approaching, and then if we have information, we also will be sending you the update through like our e-class with messages. Now, so parents, if you have anything, then through the PTA, let us know. We'll try to respond as soon as possible. I think that's what I can inform parents in the meantime. Should you have further questions, please feel free to ask me later on in the Q&A session. Thank you, Dr. Lai.
Thank you very much. I hope our transmission is okay, because we're testing our new system in the DBS. So I know that we were told that the sound transmission may not be as good. So I'm speaking closer to the mic now. Well, I can see Samson Low, the chairman of PTA here. Would you like to say hello or raise any question for us? You can switch your mic on.
Okay.
Then we'll open the Q&A.
Okay. I think the talk is very informative, and I've given some hints how to select which vaccine the parents can choose. As my kids already have dosage already, so because that's the secondary boys, but for primary students, I would like to know any suggestion. I know the Sinovac is coronavirus is less reaction than BioNTech, but is it better to have a injection at the arm or the leg, and see which have less reaction? Do you have any idea?
Okay, the injection site is not actually based on solid evidence. It is based on Professor Yun's expert opinion after he has studied BioNTech in an animal model. He demonstrated that BioNTech would cause very bad myocarditis in those animals if that is given sort of directly into the bloodstream, right? After one dose, after second dose is really terrible. And therefore, he's of the opinion, if it is further away from the heart, in the thigh, then before they get into the bloodstream, then it might be filtered off by the lymph node. So that is his expert opinion. So it's not based on evidence in human study, all right? Mm-hmm. So in order to provide choice to our citizens, the scientific committee agreed. If parents prefer for the BioNTech to be given on the thigh, you go ahead. If you prefer to be given on the arm, go ahead. But for CoronaVac or the Sinovac product, there's no need, because I've told you already, over 100 million doses have been given to this age category, 5 to 11. There's no safety signal at all, and there's no myocarditis. And that is a fact. And that fact was supported by a very careful study conducted by Professor Ian Wong, which is a population-based, what we call a surveillance study of the millions and millions of doses of CoronaVac given in Hong Kong, as compared to BioNTech. And BioNTech definitely caused myocarditis, mainly in the males, very high in the young male adolescents, 12 to 17, but also caused myocarditis in the young male adults, all the way up to even 39, I think maybe even 49 years of age. But that increase is not as high as in the young adolescents. So it's the pediatricians that alerted the government on the myocarditis, because we had a very good group headed by Mike Wan and Patrick and so on. So once we've got a young boy or young girl with chest pain, they will get very thorough investigation. Everything is arranged. As I speak now, in fact, that group have another report of another adolescent who at the first dose of BioNTech had myocarditis. So that is a fact. So they would get myocarditis even after one dose, but much more so after 2 doses. So I think this is so important information, and I keep iterating it. Of course, it's rare, but you know, it's about perception. If you think 1 in 2,800 is rare, yeah, of course it's rare. That means you have to do 2,800 doses before you see 1 after dose 2. All right. But when you talk about the benefits of COVID vaccine in children, because of the severity of the disease once they got infected, is not as high as old people or adults, then the safety issue is becoming even more important as compared to the adults. So I hope I've made it myself clear, Samson.
Let me have to
Yes, thank you.
focus.
好意思啊，Samson。
我明白。
你明啦，嗬
clear。
不如
OK
我哋可以轉為中文答呢個 Q&S 咧，因為
好啊，冇問題，係。但我見到 Verma
容許我聚焦喺呢個題目先，因為我明白好多家長都話，哇，心發炎喎，好大事喎，心，所以我哋係要明白家長係擔心嘅。
明白。
咁頭先劉醫生咧就已經幫大家解釋咗，係會見到尤其是用 Sinovac
唔係用 Corona 咧，唔係用 Corona 係冇嘅，係 BioNTech 先有嘅。
係冇嘅嚇。咁呢個係你哋要知道選擇。咁當然你話嗰個低風險啲嘅效力係咪咁大咧？咁呢個大家要平衡呢樣嘢啦。呢個就全世界呢個面對嘅問題。但係呢個資料係好重要嘅，同埋我哋見到好多啲細路咧，我哋香港好小心，全部請晒佢入廠嘅所謂，即係 check 過晒之後咧。都現時都冇見到有啲特別大嘅問題，即係全部過期嘅，個 time frame 咧都要 recover 㗎啦。所以呢個好重要資料。頭先我哋點啲 address one issue 啦，咁亦都好多問題。咁我會俾一個 host 開始問，亦都有人舉咗手，我哋會請你哋去問嘅。
我都想跟進下呢個 myocarditis。Professor 可唔可以同啲家長講一講個 percentage 底有幾多啊？會唔會話1% 啊，定係少嘅1% 啊，定係少嘅？
頭先講咗啦，如果係男仔。頭先我都講咗啦，12歲到17歲打第2針之後咧，你打到2800個男仔咧，就有1個有 myocarditis。myocarditis 咧叫心肌炎，即係你個肌肉會發炎。咁肌肉發炎當然有好多衍生嘅問題啦。咁嗰個症狀咧就會胸口會痛啦，呼吸會困難啦，同埋個心率會唔正常啦，會跳得好快啦。咁通常咧就係打完針之後嘅1個星期10日，但係我哋都見過係遠到去幾個星期之後嘅。咁當然而家全部喺香港嗰100幾宗啦嚇，當然我就係知道細路仔嗰啲咧都有復原嘅。咁但係因為個心臟肌肉發炎咧， 唔係一個小事情嚟噶嘛，係個大事情嚟噶嘛。咁所以我哋心臟科同事咧都極度小心，要佢哋有咗心肌炎之後咧，跟住嗰3到6個月咧都唔應該做任何運動。咁然後再去 check 佢哋究竟個心臟復原咗未？咁心肌炎喺美國就都唔少，係講緊幾千宗心肌炎嘅，咁都有死亡嘅個案。咁嗰啲就好少啦。你諗下美國打唔到幾多億針，咁啊死1個、2個、3個咁樣樣。咁咧就唔係淨止 BioNTech 嘅 ，Moderna 都係 mRNA 都有死亡嘅報導。咁我咧就唔想淡化呢一樣嘢，我淨係又唔想話哇好危險唔好打，我淨係想講翻啲數字，等每個人都會知道。因為呢個心肌炎嘅問題，我舊年4月嗰陣時第一次喺嗰個委員會睇到，點解會心跳咁快嘅打完 BioNTech，咁我就 flag up 咗嘅。咁後來先至再過咗1-2個月咧。啲數據喺以色列，跟住喺美國嘅軍隊裏邊咧，先至有報零星嘅個案。咁去到6、7月嗰陣時咧，都唔係好大件事。到後邊，咁我哋自己開始打嗰陣時，咁我估算用美國嗰個發病率咧，全香港所有嗰啲中學生打晒咧，都唔應該多過13宗。但我未夠2-3個星期打第2針，已經見到20宗、30宗、40宗、50宗，我梗係驚啦！即係美國人係錯嘅，佢哋係漏咗好多嘅。好對唔住，好對唔住，因為美國嗰個 healthcare system 係冇香港咁好。香港真係一個比較均勻嘅社會嚟嘅。美國有啲好多窮嘅，或者佢 pandemic 嗰陣時根本就冇能力去照顧呢一班咁嘅。好啊，有啲少少收，因為收嗰度幾日就會好翻㗎啦。
因為我哋都好多題目入緊嚟啦。咁 Simon，你會問下一條題目。
不如我哋 summarize 啲題目啦。
好啊，好啊。
有啲家長就問其實喺細路仔可唔可以打即係alternate 咁打咧？即係打 dose of Sinovac 跟住打 dose of BioNTech。
咁得意啊 ！Alright， 嗱我咧就好均真嘅。咁譬如你其實如果 Coronavirus 咧，你打2針啦，因為嗰個就基本餐嚟嘅。打到第3針咧就都唔錯㗎啦，因為我諗而家國家嘅層面就全部都打3針㗎啦，細路仔仲未。咁香港咧18歲以上全部都打3針，因為嗰個咧就係用翻我哋以前好多經驗，都係呢個滅活平台。譬如而家你啲細路仔會打呢個 polio 啊，即係小兒麻痹，咁嗰個就係滅活平台。咁你 BB 嗰陣時已經打3針啦，你到你1歲又打針啦，18個月又打針啦，小1又打針啦，到小6又打針，係打6針嘅。咁所以呢啲係叫即係舊嘅平台咧，就係要慢慢嚟嘅，即係好似你去燉一樣嘢係慢慢燉嘅。咁 BioNTech 咧，好似如果有家長係炒餸嘅，就嗰個就猛火都嚇死你，嘭嘭聲嘅。咁啊炒2下就搞掂。咁 BioNTech 你慢慢燉，你咪燉6次咯。我唔知其他啲家長明唔明？我真係唔想用嗰啲醫學名詞，你哋真係唔係好明嘅。BioNTech 就大火去炒2兜2下就搞掂。Coronavirus 咧就慢慢炆嘅，要炆好多次，要炆3次。
係。咁即係如果溝針嘅話咧，就未係建議嘅，係嘛？
暫時香港就幾少啦，但係咧，我就知道好多啲朋友頭嗰2針 BioNTech 就累低晒。咁本嚟政府唔俾佢哋打 Corona，我話傻啦，你唔俾佢打，咁啊即係我絕大部分人話要罰，即係話劉醫生你唔好咁癲啦。咁最後都俾咯，因為我覺得
你搞掂第1針先啦。
所以我就係覺得其實呢個香港嘅社會，其實我哋要相信我嘅市民，我哋要將所有嘅信息講俾佢聽。能夠俾到佢哋有個選擇就俾個選擇，唔好咁傲慢啦。我哋叫做去講。
係啊，我好快我 combine 幾個 question
好啊
related to 即係而家嗰個 vaccine， 咁就即係 basically 咧，而家呢個而家個 Omicron 咧係咪 more contagious？
OK， 好啊。
Compared to 另外啲 variant 喺尤其是呢個 pediatric population 啦，咁打咗針，另外再 comment 下，可唔可以有家長 worry about， 即係想知道嗰個打咗針喺呢一個 population 有冇任何 long-term implication， 同埋個 side effect profile compared to 如果打咗喺即係之前打咗喺大人嘅 population 又有咩啲分別咧？唔該。
嗰度好多 composite 問題。
係，我答翻問第一條先。
首先講啊，就咁個 contagiousness 喺呢個。
OK， 嗱 Omicron 咧嗰個傳播率係好驚人嘅。咁有幾個原因咧？ 第一就佢係主要喺上呼吸系統度複製啦，就唔係好似之前嗰啲係下呼吸系統。咁下呼吸即係肺啦，即係所以 Omicron 咧產生肺炎個機率咧就係少啲嘅。咁根據所有嘅文獻咧，如果相對嘅 Delta 咧，你因為 Omicron 要入醫院嗰個風險咧係少過 Delta 一半以上，可能係剩翻1/3到嘅啫。如果係死亡嘅話咧，就可能係低到剩翻1/10，甚至乎係13/1咁樣樣。咁呢個 data 已經好紮實㗎啦，由南非講嘅，跟住美國唔係英國，跟住歐洲，美國就差嘅，即係美國真係好差嘅，因為佢實在太過 patchy 啦啲嘢，所以個死亡率頭先個女都有講都係上升嘅，咁佢哋真係做得好差，講真。嗱呢個第一點，咁所以呢個 Omicron 咧，佢 intrinsically 佢本質咧係比 Delta 係輕嘅，但唔係表示唔會有殺傷力喎，因為我哋要知道南非嗰啲咧就係已經打咗針就唔多，但係咧佢曾經俾3個 wave 洗禮過嘅嚇，就當然係之前個 Delta 啦，再之前嗰個 Beta 啦，仲有一個原草株啦，咁佢4雲啊，撈咗4雲，咁所以一個人口成個社會要點樣咧？得2樣嘢你可以有呢個免疫力嘅啫，一就係感染，即係好似南非，哇！你洗咗4次牌，即係你好似洗4次地啦，拖咗4次地，你都冇乜地方冇俾佢即係拖過㗎啦。咁有打針雖然唔多，但係即係咁樣樣，咁先至有咁樣嘅結局。咁英國嚟講一樣，因為咧佢而家95%嘅人咧都已經血裏邊已經知道佢係 either 係打咗針，或加減有埋感染之後，先至會得出呢個咁嘅結局。似乎 Omicron 掃你一次，你好多人感染，但係真係要入醫院死嘅咧，係唔係好多？比上次冇咁多，但係都死。譬如英國上幾日已經有50幾60個人死啦。咁英國咧嘅人口係我哋嘅10倍，亦即係我哋每日有6、7個人會死啦。嗱，嗰個仲係話我哋打針係打到好似英國咁好喎，英國啲老人家打差唔多100% 㗎啦，你要明啊？咁同埋佢又比之前洗禮過㗎，咁所以你每日除10就係等於我哋。咁佢哋講緊慢聲，即係我哋每日有成1000幾、2000、3000宗㗎。如果我哋而家就即刻與病毒共存，咁每日就死大概哇，我諗10幾20個啦每日。咁哇，咁點算啊？咁所以而家咪好驚咯。點解不停呼籲啲人叫老人家打？而家老人家60歲以上長50萬未打㗎，呢排就好啲。呢排就好啲，咁所以咧就大概係咁。咁頭先有個問題咧，就係講翻話，你又話即係coronavirus 產生個抗體冇咁高，但係保護重症一樣咁好，點解？就係嗰個 T 細胞頭先劉醫生講咗啦，因為疫苗嗰個發展咧喺呢咁多10年咧，淨係講抗體嘅啫。做疫苗嗰啲人，如果佢唔係免疫學家咧，對 T 細胞嘅認識唔高嘅。咁而家出現咗 Covid 之後咧 ，T 細胞先受到重視。先至知道原來 T 細胞咧就係保護你唔好死亡，唔好有重症。咁 Omicron 咧逃脫呢一個抗體咧，即係而家現今嗰啲即係 pre-Omicron 嗰啲疫苗咧，係逃脫到即係基本上你過1、2個月就冇晒㗎啦，即係冇咗90%、80%嗰啲力量。但 T 細胞佢都逃脫，但係逃脫得唔多，逃脫1至2成，2成到。點解咧？就因為佢變嚟變去就件衫轉咗，嗱，用翻另一個比喻啦，你可以轉件衫好容易，即係個 spike 就你件衫啦，有紅色、綠色、橙色乜色都有。但係呢個心啊，就個 nuclear capsid 啦，你唔可以轉得太多，你轉得太多你已經死咗㗎啦。而家 coronavirus 嗰個好處咧就係佢個心喺度，個 nuclear capsid 喺度，佢同埋啲皮骨都喺度 ，membrane 同埋啲 envelope 啲皮同骨都喺度，即係你啲皮膚啊。Spike 咧，你可以想象佢一件衫嚟嘅，佢梗係可以轉啦，咪轉到40-50笪地方係有個 mutation， 所以咧 Omicron 嘅出現換咗件衫完全唔見樣嘅咧，就會將呢2隻疫苗嗰個效力咧就拉近咗好多啦。以前人哋係睇唔起 coronavirus 嘅，而家咧就知道都唔係，原來佢裏邊啲心係幾好嘅，可以保護到佢嗰個重症同埋死亡。我希望我答到係咪頭先有位？
不如我喺呢度都可以俾少少資料，因為今朝早我都喺報紙睇啦，我都好小心睇報紙資料係咪準確咧。今日新加坡公佈咗佢就有即係過去1年咧820幾個死亡。係
啊，嗰個 Bloomberg 㗎嘛，雷醫生我知。
最大問題係咩咧？70%係冇打針。 70%係冇打針。其實我哋想句話俾大家聽咧，總之打咗咧就有 protection。如果好清楚講到，如果打 Sinovac 咧，就係每100,000咧就有11個 case。Sinovac 咧就7.8，BioNTech 6.2。其實大家都係個個都 protect 嘅。嗱，當然佢就話法國 Moderna 最勁咯，但係我哋香港冇得打嘅。
嗱，唔係，阿雷醫生，我再解釋一次啦，因為今日即係佢都係 Bloomberg 出嘅。咁嗰個咧就係個黃部長，即係安部長，即係佢個衞生部長。佢其實呢個資料大概幾個星期前喺嗰個記者招待會講咗，但係佢最重要嗰句咧，佢話呢個咧我哋叫 raw data。raw 嘅意思咧係未去睇下究竟打針嗰啲人嘅年齡層係點樣樣，同埋佢係幾時打針。所以咧佢將幾隻疫苗嚟比較佢個有效性咧係好大疑惑嘅，係好多漏洞嘅。因為新加坡好似香港咁，都係啲老嘅人係會打呢個科興即係 Coronavac 或者國藥多，而打呢個 BioNTech 咧就後生嘅。所以我自己深信，將嗰個 age 即係個年齡層啊，做咗一個我哋喺統計學上叫做一個 confounding factor，將佢即係考慮埋咧，分別真係唔大㗎，真係唔大㗎。因為喺新加坡啲老華僑咧係渴望等打呢個 Coronavac 啊 Sinovac。即係同埋呢個 Sinopharm 嘅，咁政府一路都頂住，到最後頂唔順都要俾呢啲老華僑去打嘅。好啊。咁所以咧，其實有
係一樣嘅啦。
係啊，所以 Bloomberg 咧，佢講嗰啲嘢咧，你要睇真啲啊，真係睇真啲啊。咁甚至乎啲專家就咁 send 俾我個大佬爺，咁我就講翻佢哋大佬爺，你知唔知佢 age 都未去做一個即係 confounding 嘅 correction， 就咁樣 send 出去，咁唔係個個都係做科研，個個都唔係做 statistics 噶嘛，咁 Bloomberg 邊個人睇嘅啫？咁連安部長都專登講呢樣嘢，但安部長我點知佢喺國會係禮拜一講，但係呢啲數據咧係幾個星期前已經喺記者招待會講咗㗎啦。
好，
咁所以咧，
不如我哋再繼續，有好多題目。
Prof，我想即係講清楚一點，就係你係話，即係你話BioNTech 嘅 antibody 高啲嘅。咁但係咧就 for 兩隻 vaccine prevent severe infection 嘅 percentage 其實都係差唔多，可唔可以咁講？
呢個我估算你嘅咋 ，Anthony， 你知劉醫生好均真嘅，我有 data 就講 data， 呢個我即係估算嚟嘅，因為喺嗰個智利，因為已經俾咗 Omicron 洗禮啦嘛，同埋咧所有嘅比較咧係唔妥當嘅，甚至乎我教我啲 MBBS 嘅學生咧，你將之前嘅 Phase 3 study 咁比較都唔妥當。即係譬如喺巴西做嗰個 Coronavac， 佢嗰個 subject 係啲醫護人員嚟㗎，咁 Fireside 係普通市民嚟㗎 ，community 㗎，咁所以咧喺 Brazil 嗰個 study 咧，佢就可以睇到 Coronavac 真係可以 100% 即係可謂保護唔好死亡，或者有70-80% 保護呢個重症，但係嗰個保護淨係話感染咧得50幾個%㗎咋，咁所以 Fireside 嗰個第一個即係 pivotal study 咧，佢係冇 data on severity。或者係死亡嘅，咁但係啲人唔記得晒㗎啦。咁好在喺 real world 咧，頭先我咪俾咗 USA 嗰啲咧，佢真係可以保護到死亡重症嘅。咁啊，即係我都好心水，因為我做晒佢嗰啲 spike T cell 係得㗎嘛 ，BioNTech。你明唔明啊？咁所以咧，我頭先講嗰啲咧係我綜合咗，我讀過咁多書，諗過咁多嘢，我自己嘅數據再俾市民睇。咁我自己嘅取態，我琴日都同林鄭所有啲局長，我哋而家。最重要嘅就唔好捧一隻疫苗踩另一隻，兩隻都咁好，揀一隻你啱心水就打入去，咁就得㗎啦。
好，
唔好意思，我覺得比較激動啲啊，唔好意思嚇，因為我搞到
因為大家都好擔心啲細路，大家都好擔心我哋香港啦，所以都係想揾咗路。
係啊係啊。
其實我見到咧，香港係有 victim of the success 嘅，其實香港真係做得好好。咁如果我哋自己而家面對一個係其他世界咧，就唔會見到問題啦。咁我哋係好多疑問啊，其他嘢咁樣嚇。咁我哋最後一條問題
好聰明嘅，就係咪 Julissa？ 我唔知佢係邊個啦。佢話：如果打針夠唔夠？咁第一針你記得舊年9月幾咧？我哋見到第二針太危險啦，就停咗佢嘅。咁嗰陣時我哎呀死啦！第一針夠唔夠？咁我啱睇咗啲數據啦，一針可以頂得上一陣嘅咋。如果 Omicron 係保護唔到嘅。咁同埋佢出嗰啲所謂 T 細胞又好乜都好咧，其實真係唔多夠嘅，到最後你都要打2針。但係如果你相隔咗3個月打，唔係21日咧，你嗰個心肌炎嘅發生率咧就可以減低到之前嘅1/10。你明唔明我意思啊？ 即係2800個有一個咧，就估算係到28000個先有一個，咁都係值得嘅，係咪？即係如果你想高啲抗體，咁但係頭先劉醫生都講咗啦，個 T 細胞先係保護嗰個死亡同埋重症，咁你揀一個你自己啱心水就得㗎啦。
係 ，thank you，thank you。劉醫生好快問一問咧，家長有幾個都問咧 about 即係12歲啱啱細蚊仔 turn 12歲打 adult dose，又話因為而家有新出呢個 pediatric 嘅 lower dose，咁究竟係咪應該 consider 埋呢個 lower dose 咧？有幾位都問呢個問題。
係好尷尬啊！因為舊年咧我哋7、8、9月嗰陣時發過呢個問題咧，啲人已經話點解會咁㗎？中國人因為多咁多，係咪我哋啲身材啊體重係細過美國人？咁我諗嚟諗去應該係啩，呢個第一樣嘢啦。咁第二樣嘢就即係好可能係人種啦 ，who knows？I don't know。咁但係我到最終咧都係覺得係嗰個 reporting system 咯。頭先講嗰啲係 clinical myocarditis，咁好多坊間嘅心臟科同事咧都有同我聯絡嘅，佢話：劉醫生啊，其實我哋成日都有見到啲大人啊，打完之後有啲心亂咁跳啊，等等嗰啲，佢話呢啲係咪 subclinical myocarditis？ 等你有 arrhythmia， 等我話咁呢個有機會啦，有可能啦，因為 focal myocarditis 咧好難斷症嘅嚇，咁嗰啲就有陣時會引起一啲心律嘅失常。咁所以你話如果你啱12歲，係咪就要打 full dose？ 咁你梗係有啲擔心啦。咁我都講咗，我啱啱琴日先至有一個打 first dose 嘅，唔知12、13歲嘅就即係原來過唔知幾多日之後，阿關醫生好似喺度就有心痛啊，咁啊入咗醫院，咁去咗即係某一間醫院啦，唔好講邊度啦，即係大概咁樣。咁啲人咪哎呀，不如減 dose 啦，咁所以 BioNTech 咪減到1/3咯。但係佢就仍然維持21日嘅。咁我同啲美國朋友開會就話，我哋就話不如咁啦，你拉長少少打啦喺美國咁。我啲美國同事講：你唔講嘢啊！我哋要快手打晒2針，我哋已經知道即係火燒後欄，一定要快，唔好似你哋亞洲慢慢嚟，好似燉嘢咁。我哋唔得，我哋要炒起佢，咪真係你明唔明啊？咁每一個地方地區嘅 epidemiology 唔同，即係我哋嘅流行嘅性質唔同，我哋嘅體質唔同，咁所以咧就唔可以就咁齋讀書就咁將佢搬過嚟香港，唔得㗎。
係因為時間問題啦，不如我哋企圖好快 summarize 咗，我哋講咗好多嘢啦，咁亦都希望大家可以掌握到有啲有用嘅資料。好啊，不如
我哋有幾個家長就問緊，又而家喺外國係咪 develop 緊啲 Omicron specific 嘅 vaccine？ 咁如果係嘅話，需唔需要等到 develop 咗呢啲 vaccine 先至打，定係而家就打定我哋有嗰啲 vaccine 咧？
我諗你唔好等啦，等就叫嘢。
到時 outdate 咗啦，嗰啲波衫唔啱嘅啦。
咁咧，我哋香港
第二隻變種啦，係嘛？
嗱，嗰個 Omicron 咧，其實大家有個咁嘅睇法嘅，因為佢比較溫和啲啦，雖然佢傳播力好高。咁你點樣使到更加溫和咧？就你自己打咗疫苗，打第一代嘅疫苗就已經得㗎啦，已經係證明咗100次、10000次、1000次，哇，800萬聲㗎啦，即係全世界嗰個經驗。即係如果你要再等嗰個咧，就係傻嘅。我自己覺得你可以等。嗱，Fireside咧就話會做㗎啦，到年中。咁國藥咧，我琴日開會都聽到，好似佢已經向緊國家申請緊做啲 Phase 1、2嗰啲咁樣，又係到年中就會有啦。我自己嘅主張咧，如果 Omicron 真係最後一個變種株，使到我哋人類可以走出呢個大流行，就係唔好再打 Omicron 嗰啲啦。你希望 Omicron 同我哋長存啊嚇！如果到最後，我哋佢嘅死亡率，我哋睇到唔係之前咧就200個死1個嘅嚇，嗰個原草株我哋有任何抵抗力都冇。而家經過成年2年嘅折騰咧，你一係就死咗，一係就有感染，一係就好翻，一係就打咗針。嗰個死亡率咧喺新加坡咧，而家大概1000個咧係大概1至2個度。咁新加坡當然同香港接近啦，都係好多冇感染。但係新加坡你記得舊年年中咧，佢就與病毒共存，所以就俾 Delta 洗咗一次地啦，我哋叫做。咁佢而家個死亡率，我琴日再睇翻咧，就大概係1000個有1至2個度。但係其實都唔夠低嘅，我希望佢1000個唔好多過1個，起都可能係半個度啊。但係佢而家嘅病毒共存咧係同 Omicron， 所以佢琴日嗰個病例咧已經衝到3000。咁安部長啊同埋其實呢個部長冇1-2個月就出嚟講嘅，咁啲 data 日日都有嘅新加坡。 咁佢就預計到春節嗰陣時會衝到去唔知啊，佢先估計最差情況可能4000宗、5000宗，但係咧佢個醫療系統頂得順嘅，因為頭先都講咗啦，佢比 Delta 冇咁強勁啦，咁同埋佢又比 Delta 洗咗一次禮啦，咁所以咧佢就覺得佢頂得順，佢就比 Omicron 再俾多一次佢哋嗰個人口多一層保護，所以 Omicron 咧其實係上天賜俾我哋嘅某一種程度免費嘅 vaccine， 可以咁樣睇。咁但係當然啦，哇！你咁都得，劉宇龍唔係，如果你打晒2針3針，你基本上係咁。你最擔心嘅咧就係老同埋弱嘅 ，right？ 老嘅咧就係尤其是老人院嗰啲，大概有幾萬個老人家打到都冇1成啊，喺啲老人院或者嗰啲傷殘嗰啲，真係好多人驚㗎。咁學校咧就衞生即係教育局已經講到，你打7成就可以面授課程，但係嗰個吸引力唔係太高啦。但係我聽到個消息就係你冇打針就唔好返學啦，即係大概係咁，你就 Zoom 啦。係啊，咪呢個就疫苗護照、疫苗通行證或者疫苗氣泡嗰個諗法啦。政府應該就會出爐㗎啦，呢啲嘢我覺得係啊。咁所以冇辦法啦，因為香港折騰咗咁多年，即係唔係咁多年啦，2年。如果再係咁樣打法，都唔知打到天光，都未打到老人家、細路仔。咁即係我諗，即係要走出呢個疫症，一定要大家齊心去打啦。有一位叫做 Alice Wong 好聰明嘅，又講話係咪呢個 species going to vanish 啊等等。其實我就覺得，如果 Omicron 有一個 Omicron version 2又再柔弱啲，又感染快啲，咁咪俾佢咯嚇，即係大概係咁咯嚇。
正常咧 virus 係會mutate冇咁強勁嘅，呢個係
嗱有人咁講啦，但係冇人保證到㗎。我都講過堂書，我希望 Omicron 咧就，我覺得
佢哋太 clever 啦。
係啦嚇，咁但係佢
我諗佢唔會用純碳。
唔係，佢整死晒我哋又冇乜好處嘅，因為整死咗佢都死，因為 virus 就要靠生命體去複製佢㗎嘛。但係呢個 Bonita Lam 就聰明到暈啦，佢話點解個 dose 唔係用 weight 用 age？ 因為咧所有嘅藥都係用個 dose 係用個 weight 㗎嘛，所以你啲家長勁聰明啦，我叫做係啊，但係冇辦法啦，因為如果你個個都要稱完之後先睇打幾多，即係打到都唔知幾時先。
如果0.003秒嘅打唔到啦。But anyway， 好啦，我哋真係時間問題咧，我哋好多問題問唔完嘅，咁我哋可能會有咗途徑俾大家繼續喺 internal 去問啲題目啦。咁就容許我即係 maybe 我都唔夠膽話可以 summarize 頭先我哋講咁多嘢啦。頭先我 set 咗條題目俾劉教授就話點解要打？我諗相信佢會講到俾大家聽好清楚嘅啦。咁問題就係打邊隻？咁頭先佢哋都解釋咗，香港得2種揀啫。咁大家可以睇下高風險、低回報、低風險、高回報啊，定係點？大家真係知道之後咧，自己去決定啦。咁幾時打咧？呢個就係大家可能猶豫嘅地方啦。係前日咧、後日咧，再等啲。我諗呢個可能大家嘅判斷啦。咁邊個應該打咧？頭先我相信劉教授都講，大部分人已經係可以打嘅，其實冇咩嘢係未必係。有疑問你可以再問一問咯。喺邊度打？頭先阿菲Miss Lau 咧講咗少少啦。如果我哋睇下大家家長嘅傾向係點，係咪方便大家喺學校去做到咧？如果學校去做到，我哋舊生會 Medical Chamber 會唔會係支援你哋咧？咁我哋會到時可以睇一睇呢個 option 嘅。咁當然唔使出去街排咧，就會係好好啦。咁我哋一定會照顧我哋自己兄弟嘅。咁我哋到時睇睇點做。咁 how 咧，佢頭先講過啦，仲有好多細苗嘅嘢，打大髀啊，定其他嘢咁樣。劉教授有冇 interpret 嗰啲就講咁多嘢啊？我都好辛苦。係啦，總之你啲家長都好聰明嘅，佢啲問題真係即係已經反映到佢哋即係諗咗好多嘢㗎啦。咁有啲家長譬如 Sharon 喂，我問咗我個仔12歲喎，究竟打 full dose 定係 one third dose？ 我都講唔到俾你聽啊，係咯。咁就如果係好奀好瘦嘅，咁你我打 one third dose 啦。即係如果你真係想揀 BioNTech，我諗啊，因為呢個簡直有啲荒謬。點解啱啱過一日之後就打 full dose， 一日之前就話 third dose？ 所以我話你啲家長勁聰明就係咁解咯。所以如果我哋叫我仲想提一提咧，劉教授好想大家咧之後，我一會俾個網址你哋咧入翻去，作為今日聽完之後嘅再一次做一個 survey， 睇你哋對呢個成鋪嘢嘅。係啊，咁我哋介紹呢個 survey 好唔好啊？我盡量幫你手。好啊，拜託嗰200幾位家長啊，因為劉醫生咧就不停喺度講打疫苗，咁我而家咧就做緊一個小學生嗰啲 survey 啊，睇下佢哋究竟幾多想打，如果打中意打邊一隻，咁如果唔打佢嘅憂慮係啲咩嘢？
咁你之前未聽我之前，可能都做咗嗰個 survey，咁希望你聽完之後聽日你又再做，咁我睇下我會唔會再講得更加明白啲啦，因為你可以就咁打話，哇，劉醫生你講得太艱辛啦，或者之類呢啲，咁我睇下我有冇用去使到唔想打啲人都，哎呀我都去打啦咁樣，即係大概。
咁我麻煩阿 Samson 再一次傳嗰個 link 俾大家啦，就大家幫手，因為我哋學者咧好重要呢啲咧，即係評估翻我哋講嘅嘢係咪收唔收到定係接受到。唔係
做得最緊要咧，得個女啊，我就會同全香港講佢哋嘅憂慮咩，我就會再用我嘅方法同佢哋釋疑又好咩都，我會講埋俾政府聽。你譬如如果你加 Coronavirus 有，因為我而家有一個好細嘅標本量，大概係有200幾個學生家長，大概有60%係想打嘅，咁個想打嘅咧，大半就係想打呢個科興嘅。
好啊，
因為都講話到校嘅咧就係打科興嘅，即係冇得打呢個 BioNTech 嘅，係都大概係咁樣樣。
好，不如 Simon 你作最後總結，或者多謝。
我想 add 多個 note 就係首先 obviously 多謝劉教授啦。咁佢出個即係當 Samson 幫我哋去 pass 嗰個 survey 嘅時候咧，因為我哋都 capture 晒頭先所有家長嘅問題，所以好抱歉頭先時間唔夠咧，答唔晒咧，我哋都盡量 pass 翻俾阿劉教授去俾brief comments to all those questions when we send it out to parents。咁冇嘅，即係最我都係 echo Dr. Lui Dr. Anthony 就係 basically 係即係唔好等啦，即係 basically I think the safety data is very compelling。同埋咧同埋 basically 咧兩個到頭來咧都 very effective， 咁所以咧thank you 學校 provide 平台，令到啲家長可以快啲可以protect our children。So thank you。
好啊。
另外Professor Lau，如果你個 talk 嘅 PDF 我哋可唔可以 share 出去啊？同埋如果我哋要 recording，可唔可以喺一個social platform 咁樣
冇問題啊！你即係你好多人都即係我都冇問題㗎嚇，因為嗰啲都係公開嘅資料。咁劉醫生，我諗大部分人都知我嗰個取態係咩，係要公開啦，要透明啦，要將資訊廣為傳播啦。咁所以你做我啲 slide
或者 Miss Low closing remark
或者 Miss Low closing remark 啊，
係啦，
咁我就再次多謝劉醫生啦，同埋 Dr. Lui、Simon、Dr. Teo。咁其實 within 好短嘅時間，我哋可以做到呢一個嘅 webinar 或者係 Zoom meeting 啦。咁將一個真係咁樣嘅平台，等嘅家長可以真係由你嘅 concern 可以即係直接問啲專家，呢個係最好噶啦。咁當然即係我哋就係即係有好大嘅支援，就係因為我哋有DSOB 呢個 medical chapter， 有好多嘅醫生嘅 old boys， 咁可以真係有第一時間有啲咩嘢我哋係需要 support 嘅，呢一班嘅 old boys 醫生就係我哋即係好好嘅後盾啦。咁其實有啲咩嘢我哋就會第一時間再同家長聯絡啦，同 PTA 緊密聯絡啦。咁多謝家長你今日嗰個嘅支持，嗰個嘅參與啦，多謝Dr. Lui。多謝 Dr. Lau，
好多謝，多謝啊 Professor， 有機會我哋可以有一日可以飲下茶食下飯。
嘅家長做 Lisa，
身體健康，新年快樂，大家。
Anthony 好，最緊要健康。OK。
係身體健康。
多謝。
拜拜。
OK， 拜拜。
拜拜。
Thank you， bye。
我哋可以 capture 翻啲題目嘅。